Hello, thank you
Hey.
for coming on the pod. Why don't you introduce yourself and your background and what you do, and we'll dive in from there.
Love it. So my name is Jillian Van Denend. I am a physical therapist here in Phoenix. I mostly specialize in Pilates-based physical therapy. So the clinic that I work in is a private practice with all the Pilates apparatuses, all the practitioners in there, either Pilates trained or Pilates certified. General outpatient ortho practice. We treat a variety of things. I was a competitive dancer growing up, so that's my background. Classic athlete turned physical therapist story. I had a bunch of injuries, went through PT, felt like I wasn't understood by my clinician because I was a dancer. So just very unique kind of movements. And that ultimately led me to be a physical therapist.
So what's some of your worst injuries you?
I am extremely hypermobile. So double jointed is what people typically call it streetwise, but extremely hypermobile, and I didn't really realize this until I was an adult, to be honest, when I started lifting weights. But snapping hip syndrome both sides. I think I have a torn labrum in one side. Haven't really addressed it. I'm a bad patient. I have really bad shoulder instability bilaterally, just unstable everywhere, lots of knee injuries. But the first thing that I went to PT for and got a referral for was my hips.
What are you doing for those injuries that aren't formally diagnosed?
What am I doing? Okay. So
as far as the hip,
like hip, shoulder, everything.
Yep.
So when I first kind of discovered I had all these injuries myself, this was in college when I was studying in undergrad, I took up weightlifting, and it was really hard for me to understand it because hypermobile people have a really hard time engaging their muscles. We just kind of dump into our joints all the time. And in dance, we're just meant to push through it and just keep going, right? And so I had some friends in college. We would go to the gym, and I would be like, I feel like I'm strong enough to lift the bar, but I feel like my hips are going further than everybody else's, and I feel off on one side. So once I learned more techniques, and once I got more training and learning from professors and friends and things like that, weightlifting definitely saved me for sure, just because I had a better kinesthetic awareness of my body, but also Pilates. I would say senior year of college is when I started going to classes, and I just fell in love because I danced and it won the music, going to the beat of the music.
Pilates classes,
right? So going to the beat of the music really set it off for me, but mostly it was just the choreography sequences that really clicked with my brain, and nothing ever felt like that before with exercise. So between my PT knowledge, weightlifting and Pilates, I do a mixture of both to deal with injuries.
You ever do Zumba?
I did in college a lot. Okay. Me and my mom did a lot too growing up. My mom's she loves Zumba. That was her thing.
My wife keeps trying to get my daughter, because my wife's been doing it since 20 years ago.
Oh my gosh. That's awesome.
And she's a physical therapist.
Oh yeah, cool.
So where was I going with that?
I don't know.
Zumba.
It seems like it was
Zumba.
The tangential.
Yeah.
Yeah. Think, especially with your background, stability. How do you build stability for your hip issues, your shoulder issues? Because a lot of people misunderstand that having a good stable core, actually with Pilates specifically,
totally,
your core stability really engages your whole body. And for most people, it doesn't you don't need to be that core extensive, but you get to help out your posture throughout the day, not have back problems like I'm having right now.
Which means everyone needs the core stability. Yeah. You're saying not I think more than that.
Pretty much most people do.
Yeah.
Or at least learn how to engage correctly, right? Yeah. So as far as hypermobility goes and stability in general, I kind of think of more as a neuromuscular thing rather than a physical joint thing. So obviously, people are super flexible. I grew up dancing. I have girls that are more flexible than me. I had girls that whip their legs behind their heads, and they had to. And when I was dancing, I didn't get formal. I didn't even know what Pilates was when I was dancing. I didn't know how to pick up a barbell. I was scared of that. I was scared of lifting weights. I just was fearful of working out. And I think that with being hypermobile and having that stability, it's important to not only have your joints more stable and your muscles holding your joints accountable, right? It's kind of like a tug of war between the joint and muscle with hypermobility, but also your brain being connected to your body to be able to get those muscles to fire. And I feel like Pilates does a really good job, Pilates principles in general, does a really good job at teaching people how to engage their muscles properly, whether that's starting from the core, which I always typically start, no matter people's injuries, to be honest, and then going from joint to joint and using the apparatuses and the principles as a tool in my practice to help people gain that stability and get their minds to click, right?
Yeah.
So do you have to build more muscles around your major joints that you have issues, like your shoulders or your hips? Do you have to work more on those muscles to kind of stabilize it more?
Exactly. So hypermobile people have more range of motion, right?
Yeah.
So it's harder for someone to say, for example, like my hips are extremely hypermobile. My T-band snaps over, my greater choke. So every time I take a squat, I can feel it go over, and then I have super, super deep hip flexion. Most people have trouble with that, getting into their deepest squats. And I have really a lot of dorsiflexion. So it's harder for me to control weight because I have so much range.
Yeah.
So you always want to work. I always start my patients who are very hypermobile working in a shortened, very, very small range of motion to get their muscles to fire. So it is harder in a sense, and also hard on the brain too.
But you build on that.
But you build, yeah. And it takes time. Yeah.
Yeah. Rather than pushing it to
Exactly.
an extent, like which I did last weekend, and my back's been so fucked up.
What did you do last weekend?
So I was on vacation for my first 2-week vacation ever, and I came back and I lifted not heavy weights, like I know because
it's just from the plane flight.
Yeah, sitting for so long.
Flight and all, like I just went like extremely lightweight because I'm just getting back into it.
Yeah.
And I was working out legs, lower body, and my wife called me up because I got up early from jet lag or whatever it is. So I was like, okay, I'm awake. I might as well just go to the gym. So it's like third day in a row. And she was like, you're going to the gym. This is your third day in a row. And you're probably overdoing it. And without even like knowing what I'm doing. And I was just like, don't worry. I'm going extremely low weight, very slow. And I swear I hung up that phone, and that next set I was doing squats in my back. I was just like, oh, fuck. Yeah. My whole body started seizing up, and I'm like, why'd you jinx me like that? And this is the reason I didn't want to work out with her when we first started going out when I was like in my 20s. It's just like, she just like corrected everything I was doing. I was like, oh God, I do not like working out with you. But it was the next set after she called me, and she's like, you're overdoing it. Yeah. You're overdoing it. You shouldn't be doing this much. And I'm like, yeah, whatever. And then like 2 reps later, I was like,
it's like she knows what she's talking about, right?
Yeah. Fucking physical therapist.
So how's the Pilates that you do for physical therapy? Is it much different than what people are doing in like the different fitness studios? Yeah.
I would say the approach is different since we're one-on-one. We get an hour-long with our patients. We're one-on-one. I'm glad I have the freedom to do that. I kind of use the tools or the apparatuses, I would say, as a progression. So for example, if someone comes in with low back pain, I do my whole assessment, my evaluation. I notice that they have poor core control, whether that's in quadruped, laying supine, lifting, trying to do like a dead bug or a bridge or something. Yeah. So if they have problems and then they report to me, hey, like I have problems doing dead bugs in class. So I test them first, and then I'm like, okay, if they're not able to keep their back in the most degrees of freedom when you're just laying on a mat, right? Yeah. Let's get you on a reformer to give you a little bit more stability, a little bit more, what I say, like kinesthetic awareness, so they can feel something press against them when they engage their core. Add all the little straps, fun stuff. Really, it's just to add like extremity activities while you try to keep your core engaged.
Yeah.
If they're ready to move on from the reformer, I progress them to mat. And that's kind of how my progressions go throughout my physical therapy.
So it goes from
clinics.
reformer to mat generally.
Yeah. So people typically think that reformer is easier than mat. Or no, mat. Wait, no.
No, I would think reformers like even having a wife that's a physical therapist, I would think reformer.
But it goes both ways.
It depends on the goal.
What type of exercise?
Because you could make something easier on a reformer, and then you could make something harder on a reformer with resistance.
It just depends.
Yeah.
So, and that's a favorite thing for physical therapists to say is it depends. But from a Pilates standpoint, mat is the most difficult for, say, because you pretty much do all the same exercises just on different apparatuses, whether that's the Cadillac, the chair, the reformer, whatever. But mat, I would say, is the hardest because it's the hardest to control because your body's alone. There's nothing to give you feedback. And so especially with my hypermobile people who have a problem with that neurofeedback, put them on the reformer, it's a lot easier for them to really feel it's working. But yes, you can add resistance to make exercises harder if they can't take the load in standing.
Yeah.
So it does go back and forth.
And what are your thoughts about, like, I don't know, I went to a few classes and like in some of these big chain places because my wife like dragged me into them. And
Stretch Lab?
Huh? No, not beyond Stretch Lab.
Oh, I love that with the Stretch Lab.
Yeah, that was
that's
like
our next sponsor.
Next sponsor.
Yeah. I was just wondering what the hell it's like. What the hell is this place? They just stretch you, not the right way, but but like I went to just try. I was like, this is kind of weird. I just went to check it out, and then they kept on messaging me to
it's always
keep going.
the phone calls.
But but
more.
no, going to Pilates, like I went to one that was not one of the chain places, and the guy knew what he was doing. But like going to some of the chain places, like the coaches don't know what they're doing, and it's like I'm gonna get hurt because I'm gonna think I can do more, and like I've lost my mobility through the years, so it's like I want to gain my mobility back with Pilates, but that's not the way to do it, you know.
And I would say that in a class setting, especially if there's like some studios have like 12, 13, 14 reformers, there's no way the instructor knows exactly what each person is doing. And you can get really hurt. Like I've had people come in to me because they got hurt in a Pilates class and they want to get back to it. So,
the other thing is, like, if I'm in better shape than the person instructing me, it's kind of questionable.
Like,
That's why you don't go to a dentist that has less teeth than you.
Exactly. And you want to trust your provider and your coach too. And especially for me, like what I'm looking for in a Pilates, because I go to Pilates classes on my own, and I'm a little picky because I'm a physical therapist. So I can understand if someone knows anatomy. Like there's sometimes some Pilates.
What's your rec?
What's my rec? Locally, do you like heated classes?
I don't mind heated classes.
Okay, like
Let's
105.
get a rec of everything.
Rec of everything?
Yeah, that you suggest.
Okay. So my favorite one in the Valley for heated mat is the workshop. It's very fun. Yeah. It's that red room. I don't know if you've seen it on Instagram before.
I've seen it. Yeah.
I would say I do have instructors that I like more than others just because of their knowledge. But that one's just fun, good music, good vibes, but it is dark. So I definitely, for my clients and my patients, I screen them before they're like, oh, let's go back to a mat class. I'm like, okay, hold up, wait. Like, let's make sure that you are able to do this stuff from your injury and we'll get you graduated to a mat class. So that's one of my favorites. Desert Movement is another one that we partner with. It's on 16th and Campbell.
Yeah.
They are amazing. They only have 4 reformers in the clinic. So very one-on-one, very hands-on. They make sure that you know what you're doing. And they also do mat and sculpt classes too. Those are the 2 that I love personally also. I love going to those 2. I love the girls there. But for the most part, for Pilates, that's kind of the 2 that I give.
I just had an idea today. I was like, it's like should become like a wellness blogger. Like, you know, people go and do the restaurants, but you go to the different wellness studios because we have multiple wellness people. And I'm like, you gotta go and try out their wellness studio, you know, either like red light or whatever they have, and just like, you know, give reviews on all the different ones. I think
Like
that
Yelp.
would be a
Honest
big-
reviews.
honest
That's the
reviews, yeah.
problem. Like
True.
you have the wellness bloggers or vloggers, whatever.
But they'll tell you like what works. They're not going to tell you like, oh, well, unless they're advertising for the
Yeah,
different
yeah.
students.
That's what I'm saying. That's the problem.
Yeah.
It's like, okay, is this backed up?
But you
by
could get
anything?
paid for it.
Yeah.
Yeah.
That'd be cool.
Yeah.
It'll be interesting. Like,
But
Yelp.
you could get paid to just go there.
Yes.
Or you
That's what
could
I'm
be
saying.
like
If you're
Portnoy.
gonna do that, you gotta stay honest to the
Yeah.
cause.
There you
Be
go.
like, you know what? This is bullshit. Like this guy's like telling me to do this,
Yeah.
and my back's fucked up. Like
You could be like Portnoy and like tell people to fuck off at the pizza places. But
the do you see? I know you do a lot of orthopedics,
Yeah.
and so that's a good amount of like sports injuries. What do you think about prehab, and do you see people for that?
Yes. So I actually just discharged a patient. He's about to do a total hip. So he came to see me for prehab because he can't do much. Older
Yeah.
gentleman can't do much, and the reformer and the equipment.
Older, like actual age, or like Jose? This guy's built like a 78-year-old.
Older age. Older age. Yeah. And
everyone's going to wonder who's Jose.
who's Jose?
Okay.
He's eventually going to be a guest.
Oh, awesome. Love that. You can rip into them too.
No,
you
he
go.
can't. No, he can't. We'll stop doing this show right away.
Definitely older than Jose for sure. But yeah, using like Pilates principles and core control to help before going into surgery was really helpful for him. I also treated a post-op breast lift and tummy tuck very recently, 6 weeks out, and she was very scared to go back to exercise. So I kind of slowly progressed her, and now she's back into the gym, no pain. She's all healed. She's pretty good. So that was a really fun one, I would say, to treat and interesting for me to get my hands on. So
Yeah, a lot of the tummy tucks, they're kind of afraid they're going to tear apart
Mhm.
even like months out. And like I'm like I try to get them active earlier on, but
that.
with the tummy tuck, you got to worry about it. The muscle repair, like that's the only one I kind of take it lighter with, like lifting weights and stuff up to 6 weeks. But most of the other things I do, people freak out, like, breast dogs, sending them back to
totally.
working out within a week to 2 weeks. But no, like Pilates is like, I usually try to get my patients pretty fit before, like I tell them to do the workouts and stuff. And then post-op, I try to get them back into what they can almost immediately.
Love,
So-
because the better shape and the more fit and the more strong they are before surgery, whether that's plastics, whether that's replacements, whatever kind of surgery,
Yeah.
the better the surgery outcome is going to be.
Yeah, because everything atrophies, and if you're
Yep.
already in poor shape and it atrophies even more, it's going to be harder to regain. So, like, what condition are you going to be at when it comes to surgery is very important. And just, with Pilates, they could, you could go back a lot earlier with doing weight or Pilates with the appropriate instructor, such as you or
Totally.
PT, than, not going to some Pilates class.
So just breaking it down into plain English, like you say, atrophy, people like don't understand. If you have surgery done, whether it's knee replacement, hip replacement, cosmetic surgery, tummy tuck, your body takes a hit as far as like you're going to be set back. You have to not engage certain things, certain muscle groups. So that makes those muscle groups like dwindle down. That's why I brought up prehab. Like you're going to take that hit, so might as well build it up before that surgery. It's more, I think it's even more important for like orthopedic surgery, where like you build up your leg strength before you get a knee replacement, because you have, I don't know modern protocols, but like 2 weeks of like no like
No, with the knee replacements, they get you almost right away.
They do, but
PTs.
It's more like
the
ACL. Yeah, it's like structured protocol.
But like total knee replacements, like they have weight bearing things, and it varies. You're going to go to some surgeons, especially in Arizona, with a ton of private surgeons. You're going to have some people that are completely old school, and some people that. But
that's what like some things that good came out of COVID was it shifted some of these people's mindsets, and like the orthopedic surgeons. Well, I was chair of surgery telling them if you're not going to do this as an outpatient knee replacement, you can't do it. You can't do it in the hospital. And so there were a good amount of orthopedic surgeons that were already doing it. They had PT come and see them right there and post-op day. And then, they could get their surgery done and they're out the same day. And
a lot of things with again, knee, hips. Yeah. It's range of motion stuff. Yeah. But the main thing I think that's beneficial with prehab is strengthening prior to.
Absolutely.
Because the range of motion, you can work on that. But if you're able to build up strength and stuff, the stuff you lose during that perioperative, post-operative period is going to be minimum compared to somebody that's just not doing anything, not really mobile.
Yeah. And I feel like Pilates, to tie it back, like the reformer allows you to load the joint without putting impact. So having someone that's prehab for example, like a TKA, you can have them do squatting motions, a leg press on the reformer without them having to actually do a squat where it's painful, right? Because I'm not trying to put people in more pain. Mm-hmm. I want them to regain muscle. So the reformer is a tool. Perfect example of a tool that I use.
But you're female, so you definitely want to put people through pain just by your genetics.
Just a little.
But a main thing is range of motion, mostly flexion, right? With TKAs or
flexion and
knee.
Extension both, because you want good gait mechanics, right? That's the number one thing. To get back first. And so for total knees, typically flexion, extension, range of motions that we go for first.
And how receptive are guys coming in to get rehab and you're
guys are douchebags.
Pilates versus are they coming in to you guys because you do Pilates rehab?
Half the times it's my clients' husbands. So they come in because they overhear their husbands saying they have back pain and they're like, I don't know how to engage my core. And then they come and see me and they're like, what the heck? Or it's people that just word of mouth, I did have one baseball player that came in because his dad was like, Pilates would be really good for you. And he came and saw me. We kind of just did general maintenance stuff and helped with his hip mobility. So it just depends on people's goals. Like golfers do really well with it. Anyone that needs a little bit more of core control with movement, especially golfers, tennis, anything rotational.
I was gonna say especially vicious rotation. Like
pickleball,
like you were saying, tennis. Fighters to a certain extent, but they don't rotate as much and as hard as tennis players. Baseball players, because you just go to a batting cage and try to hit 10 balls and you're like, oh, I'm exhausted. What's going on? And a lot of times, at least when I was doing it, you just kind of swinging wildly rather than being core engaged and trying to gather that strength. Not only it'll improve your strength throughout the swing, when you're doing it and you're not engaged core wise, you're kind of doing disservice to your back too. Yeah,
absolutely. And I will preface I will not help you with your swing. I am not the person to see if you want to get a better swing. I'm not the person to see if you want power in your swing, but I am the person to see how to engage your core to help enhance your swing, right? Yeah. And the core, trunk rotation is the basis of all those sports, right? So whether that trunk rotation, hip rotation, upper body rotation, thoracic. So it just gives them more awareness. And I've seen with golfers, anything rotational, golfers, tennis, whatever, Pilates kind of helps because you load it in rotation. Not a lot of times you do that in normal training. So.
Mm-hmm.
Is
And if
Tiger
you don't,
Woods doing
yeah,
Pilates?
that's what I was just about to say. If you don't engage your core, you might flip your car over.
There you go.
Like it's devastating effects.
Take oxys and alcohol.
Yes.
Yeah.
No, but it's especially golf.
Yeah.
Like in Arizona too.
Mhm.
Like that's why I never got big into golf, because every time I did it, my back was just like, yeah, you better lay off whatever
Yeah.
you're doing. But it's like when I say it's a vicious turn if you don't do it regularly and don't know how to do it properly. Like you just like kind of like doing like a back stretch with like extreme
I agree,
force.
and that's why I never did it either. I'm like, until I get appropriate coaching, I'm not gonna go and try it on my own.
It drives you mentally insane because
Yeah.
you're like, I can drive this ball further, so
Yeah.
let me go harder.
Yeah.
And there was one time just hit this like jumbo bucket of balls and then went to the batting cages after it. And I was like, all right,
Oh my
let's
gosh.
ramp this up to 85 miles an hour. It was literally like just bunting, like throwing the bat at the ball. And I was just like, oh man, and I'm freaking exhausted.
Yeah.
So you golf? How's your golfing? Right?
It's not great.
What's your handicap?
I don't
What's your
even know,
handicap?
to be
What's your
honest.
bench press? We ask all our guests, what's your bench press?
God. I am not good at golf. My husband golfs. He's also a physical therapist as well.
Okay. Same practice? Or?
Yeah, I practice. I mean, like, I just got bored of sitting in the car and riding along. So I was like, let me see if I could swing a club. So with my hypermobility, great backswing, but the control is a little different story. My husband says my swing's okay. So I'm like, okay, I mean, I can play better than my friends. So that's all that matters. But yeah, bench press. I just recently started like hybrid training, which is kind of totally opposite of everything kind of that I do. But
what's hybrid training?
Like I started going to a gym where they do a mix of strength and like conditioning cardio, because since not being a dancer, I did so much cardio, and then I went to Pilates, and you don't get much cardio from that unless you're doing like a cardio mat class, like in a 105-degree heated room or whatever. My mom recently had a stroke back in April. And so I was like, okay, I need to like get my health in check. I need to get better at cardio. I was working a lot on my joint stability earlier this year. And so now I've been doing like ergs and rowers and all these things. That's so foreign to me, but it's a lot of fun. Started bench pressing. I'd never been able to bench press a barbell ever my whole life. One, because of fear, and two, because I'm scared of my shoulder. But I bench pressed 15s on both sides the other day, and I was like, all right, like maybe the shoulder can actually do some stuff. But that's with like proper knowledge and, not just being thrown at stuff with the good coaches. But yeah, not too much. But I was like, it was just a win to be able to say I did it.
Yeah.
I stopped doing it. I just use resistance bands.
Yeah.
And the thing is, my shoulders are so bad already. It's like, with operating and holding retractors and stuff, it's like, to even like the overhead presses, I try to stay away from too much.
Yeah.
But like, bench presses, and I did pretty heavy, like competition style, like deadlift bench presses. And I was like, I got to put stop to that. Otherwise, like I couldn't do any more breast dogs. So
it's fair.
In college, I was doing these like 3-month long programs to like build up strength. And it's the good old days, no internet. So just like buy a book with
Arnold Schwarzenegger.
No, this guy was like the strength coach for like North Carolina.
Oh yeah, that one. Yeah, I had that one.
Oh, is that where I got it from?
Yeah.
Yeah, so it's like 3 months long,
pretty good.
And it was really good. Like I got very strong, but like
stick to the basics.
I was just like, okay, I got to my goal. Let me get to the next goal, and it was like 315 because I'm like 3 plates on each side. That's going to look really like cool, and like you build up, so you go 275, 295, like 2-3 reps, and then like end of the month you go for your max weight. And it was for 275 3 times. And it's like, you'll be able to hit 315 in a few weeks. And I went to like, I felt good. So I was like 5, 6, and on the 6th one, just heard my shoulders just go like, and I'm like, oh shit.
Yeah.
Like put this down ASAP and put it down right on my chest. Need a rescue.
Oh,
but like,
gosh.
then I was like, I don't need to do that.
Yeah.
But I still lifted pretty heavy after like a few months off. But like in my older age, I'm like, I don't know if I need to do this. And even when I was doing it, my friends and I still talk about it. It's just like, you know what? I added like an extra like 10 pounds, 25 pounds just to look good for the girls in the gym. And they really don't know the difference between like
no, they don't.
between like 200 pounds and 215 pounds. I'm like, oh, check this out. Watch me tear my shoulder out.
Yeah.
God.
It's a male mentality.
Yeah.
So
Just like our friend that talks about explosiveness. And I'm like, well, he does jujitsu
Oh.
or whatever.
which one?
Corley.
Oh, yeah.
But he does jujitsu. But like, we always talk about it, and he's always talking about like how he needs to have explosiveness. I'm like, dude, we're close to 50. Like, what do you need explosiveness for? I'm like, you're not a
You never
Division
know
I
when you need to
athlete
take
anymore.
somebody down for 2 points.
Yeah. Quit those days.
Just do what makes you functional
Yeah.
and alive,
Yeah.
right?
Yeah, I
That's
learned
that's
that
the
the
biggest
hard
thing.
way.
It's like,
Yeah.
just got to remind myself, like, even like later at night, you get home, you're tired, but like, just instead of like sitting around, just get up and like
Yeah.
do the stretches, get your Achilles like lengthened and your
something.
knees. Yeah.
That's
Yeah.
what I always
Instead of
say.
sitting around doom scrolling.
Any
It's like-
movement's good movement if it's safe
Even
movement.
thumbs,
Maybe.
stretch them.
You'll
So
burn
how
some
about
calories
some
there.
recovery like, do you have your patients like do anything for recovery post treatments and stuff?
I would say the biggest debate as a physical therapist that I hear a lot is heat versus ice. It's like the number one thing that I hear for pain, right?
Yeah.
For in general. My big tip that I like to give for the most part, because some clinicians are very anti-heat, some clinicians are very anti-ice. It just depends. But I like to give the advice, like if it's swollen, angry, hot, if it feels hot, ice it.
Yeah.
If it's stiff, like if you feel tense, if it's, like needs to be pliable, heat.
Yeah.
That's kind of the one thing that I usually give. As far as like cryotherapy, ice, cold plunge, things like that, I haven't tried enough myself to really like give my patients advice about it. But I say do what you like if it's not going to kill you, right?
Yeah.
Do what you prefer, your good recovery, whatever that is. And be consistent with it, because if you're not consistent, you're not going to have any results. So the one thing my patient's like, I tried red light therapy once and like it didn't help me. And I'm like, well, did you try it? Try it for a week, try it for a month.
I know.
Yeah.
And like, I tell a lot of people, because it's like I use my red light mat and it pretty much got rid of like an 8-month-old nagging back
There you go.
problem. And I tried peptides.
I thought he was going to say got rid of
things.
an 8-month-old child.
Yeah.
Oh, gosh.
That's a good red light.
It could do that too. You just got to lay in it long enough. But
I was just going to say, I'm generally, as a physician, anti-ice
Okay.
unless they're going to deport Jose.
There you go.
Great.
This is just a roast Jose session. That's all
No,
this
this is every time I try to sneak a couple Jose jokes because I only make fun of people I really like.
yeah, I think like the red and hot, like I wanted to see what your situation was, whether you recommended cold plunge. I think it's, if you're talking about, you're exactly right. The red and hot and like, you want to cool it off. But like for the red light mat, like, people are like, I tried it, it didn't work. And I'm like, trying it's not like really, I lay on mine like every night, like half an hour, 45 minutes. I even pass out on it because it's got like infrared, like near and far. And although it
He
seems like
comes
one
in
of
with
these,
marks on his face.
yeah. Although it seems like one of these like 8-in-1s from like Alibaba, it seriously, it works. Like,
Is it just a mat like on the
yeah,
floor?
it's a mat on the floor. And like my friend was about to buy just like, the red light sleeping bag. And I'm like, don't buy that. I'm like,
Yeah, that's
buy one
only
of these.
4-in-1.
No,
Why
I
don't you
was
get
like,
the 8-in-1?
I was like, well, I know what's worked. Like I haven't like taken one of those just like red light. I'm like, all these other modalities like light PEMF and stuff with it, I think it helped out. And like I was like, buy the mat instead of buying the whole sleeping bag, because for me the mat really worked. And he tried it. He said he had joint pain all over, and he runs a lot, works out a lot. He just turned 50 this year, which we went to his birthday party. But he's like, after like a week on it, he's like, he feels totally. He's like, I wake up in the morning without any pain. So it's like,
There you go.
and I've had good amount of people, and like who I've told, people that have gone and just bought straight just red light, it hasn't worked as well as buying the one with the multifunctionality.
Yeah, and do your research, right?
Yeah.
And never just listen to something you see on TikTok. Never just
Yeah.
listen to something you see on the internet. Like always do
We're
your
on
research.
TikTok, though.
Yeah, I'm on TikTok too.
Yeah,
I'm on
joking
TikTok
around.
also.
Do your Reddit research.
Do your Reddit research.
Yeah.
But yeah, I always tell patients like all movement's good movement as long as it's safe, and just choose what feels good. Like, and I want to give them the autonomy, right?
Yeah.
And the hardest job I feel like for a physical therapist is getting people to be active. Like, first and foremost. And so I always encourage people, if they're doing something, whether that's walking their dog every night for like an hour, 30 minutes, great. That's something. Now let's build on top of that.
Yeah.
So as recovery,
Like Jose holding up a sign saying 10 minutes left.
Yeah.
He
should do that every single day.
Yeah.
Maybe do
Every 10
a
minutes.
weighted 10-minute sign. It's like 10 pounds. That'll help
Just
you
hold
out.
it out. Burn out those shoulders. Oh.
Yeah, it's always, you got to just, because I forget what happened that I got away kind of from like the working out. The thing is like, it's just having 2 toddlers at home, I think. Well, a 2 and a 5-year-old. And it's like, they sleep in there. One of them sleeps in one room. One of them sleeps in our room. And then it was like, they switch rooms and then they sleep in our room. And it's like, where do I keep the gym equipment? Where do I?
Dude, they're pretty dense kids. You got to just do cleans with them.
Well, I
seriously.
got them their own gym sets in my gym. So,
Cute.
but like, it was like getting all that set and being like, all right. And actually the Italy trip, having the jet lag kind of helped, because I'm like, I'm waking up at 5, might as well work out before I get to work, and make that like, you go to sleep, you wake up,
I hear you on that. That's how I hurt my back. I was like, I was waking up at 4:30. I'm like, I might as well go to the gym.
Let's hit it 3 times in a week,
Yeah.
and I'm tired and fatigued, and my brain's fogged.
But like the thing is, like I'm telling you, like get an Oura ring or like the Whoop, like it seriously tells you, because I was like, my recovery was like shitty. It was like in the 50s. And I like stretched up and I was like, I think I just tore my serratus. I'm like doing nothing. I was like, I worked out the rest of my body,
like
and
reach
then
for baggage.
afterwards I like reached for one thing, and I'm like, oh, that's totally my stupid recovery from like working out every day. I'm like, all right, take it lightly today.
Yeah.
So
Have you ever hit 1%?
no,
That's great.
I've gone into the 30s.
I have once.
Yeah.
Congratulations.
It was on flight back from Tahiti from my honeymoon. Yeah. And I just didn't, I was so tired, sunburned everywhere, barely slept, like eating a lot, drinking a lot, And I looked at my whip score when I got on the airplane from the night before, and I was like, wow. And I looked at my husband, because he's got a whip too. And I was like, I hit the 1%. He's like, 1%. I'm like, yeah.
The Whoop, I don't check as much as the ring.
The ring.
Yeah.
What do you like better?
The ring, the app's so much easier, I think, to interpret and stuff. The Whoop, I think one of the setbacks for the Whoop is to keep your journal. And I'm like, it says, when did you drink your caffeine? And I'm like, fuck, just skip that. And if you went straight to the app every time, I think it would be because it asks you to journal what.
Yeah,
like,
but
the
just
whole
like
thing.
part of
Yeah.
it's like part of my morning routine.
Yeah.
So I like make it a habit every
Yeah.
day to check my journal off. So it keeps me accountable. But
The
yeah,
good thing is it offsets when the battery runs out in one of them. The other one's
so
like
the other
takes
one,
over.
yeah.
But like,
smart.
the thing with the Oura ring, like when it tells you you're getting sick, and like
Pretty
you
accurate.
straight up, you're like, all right, my throat's scratchy. The day after the Whoop told you your temperature was up a little bit, and your recovery's you're off a bit, and they keep on improving it. So I have the 4, now they have the 5, and they keep on just like adding more functionality to it. The thing with the Whoop is, everyone says it's great for, I just don't know if I'm wearing it right. They say it's great for like the fitness checks and stuff, but like I have.
Is it telling you you're out of shape?
Huh? Well, it tells me I'm aging at 1.6 years per year. So I'm like 50 something biological age on my Whoop. So
You should stop
not very
that.
good.
You should stop
Very
that.
Yeah.
You're like Whoop dog years
yeah.
ahead of us.
Yeah. So it's definitely telling me I'm older than I should be.
But all other metrics tell you you're younger than you should be.
Yeah.
Like the scale and
I gotta
stuff.
get a biological age test. Let's see. But yeah, it's, I kind of listen to what these things say, like and you feel like crap when it tells you
Yeah.
your scores are crap.
Yeah.
You're usually kind of feeling crap.
Do you feel 56 Whoop years old?
I don't know. The thing I was saying about the Whoop was, so I have my AI bike that I use, and that has a heart strap. So when I wear the Whoop, it's like your heart's in great condition because it doesn't, like, my heart rate doesn't even go up.
Yeah.
Like I'm on there, I'm sprinting, and it it goes up a little bit. When I put that strap around my chest, it's a lot more variability than I see from this. That's where I'm like, I don't know. It's the newer one, and people say it's like the metrics aren't as good as the older version.
Like the 4.0 version?
Yeah.
Yeah, because I had both.
Yeah.
I think I only had the 4.0 for a couple months, and this one I've had longer. And
Yeah.
I've heard the same thing from people.
Yeah. It has more functionality. It gives you EKG or whatever.
Yeah, I just do the 12 lead stress test. I just go into the cardiologist to find out where I'm at. It tells me to slow down.
I don't.
He tells me to slow down on my
You got
AI
time for that.
bike.
He's got 2 kids. You don't got time
I
for
haven't
that.
had chest pain yet to go to the cardiologist.
Yeah. I only get chest pain from my 4th Red Bull.
So what are some stretches? Like, what are some things you do on a daily basis? Like when you wake up in the morning, are there
like if you have
things
5
loosen
minutes?
up?
Yeah, actually, if
5
you have 5
minutes.
minutes, like
Do my
how
lip
would you
journal.
spend your 5 minutes?
So 5 minutes in the morning to myself.
Yeah,
If I had 5 minutes.
yeah.
Do you have kids?
No kids.
Okay.
Not yet. I try to practice deep breathing because a lot of the times, I wake up a lot of jaw pain and I feel like I'm just like so tense all the time. So if I had 5 minutes to spare, if I wake up in the morning, just take a couple of deep diaphragmatic breaths in and out, just kind of reset the nervous system, get out of bed slowly. I feel like that's a lot of things, like a big thing that a lot of my patients do. They just like, I notice they get off the table really fast. No reason. They have no reason to rush. Like slow down. Like you have 5 minutes, get out of bed slowly, like take your time to wake up. Like I'm a big coffee drinker. So the first thing I get up, get out of bed, do a little stretch. If I have time, I'll take some time to do some breath work and then set the coffee machine, but take my time. Like that's the biggest thing because I feel like everybody's just in a rush all the time. I don't really have a structured like set morning routine every morning, but like twice a week I work out in the morning. So on those weeks I try to get some carbs in before I work out, go to my workout, come back, take my time.
What type of carbs do you take in the morning?
Oh, before my workout. I usually do a rice cake, a little bit of peanut butter and some fruit. It's like my favorite pre-workout. Can't eat anything too heavy and it's like the perfect amount of sugar, I feel like, before. And I've been doing like a lot heavier lifts and lots of erg work and cardio, so I need that extra. But Pilates, I don't do. I'll probably eat like half of what I would eat for that because I feel like I don't eat as much, but I definitely eat something before I work out.
Okay. Are there any stretches or like warm-ups that you do before working out? Or
I
You're a
tried.
dancer, so do you like kick your leg over your head like 8 times before you?
I might have done that when I was 17, but not anymore.
Like, I'm up, check this out.
Yeah. I try to do dynamic warm-ups if I'm going to do like independent lift. Whoa. So kind of like your walk
was
across the
dynamic.
turf. Like hamstring scoops, quad pulls, like your normal like kind of athletic dynamic warm-up back and forth on turf. I love that kind of stuff. I grew up static stretching and holding it for like 30 seconds and holding it there, which I feel kind of doesn't really do anything for the most part. I mean, it worked for my flexibility wise, but it wrecked my joints as a dancer. And like now that I'm older, I'm like, okay, I love like a good dynamic warm up before I lift because it makes me
Research
feel
shows that dynamics way
better
more,
than static. So I wish I knew that as a dancer. And still like, it's just education. I feel like now, especially because I was so tied to the dance community, like train like an athlete. And that's one
that
thing.
could be your TikTok hit. It's showing all the dynamic stretches to do.
Dynamic versus static.
Dynamic
Yeah,
versus
because
static.
everyone still does. Everyone's like huge into just the static. I even like, you know, like you feel something's tight and it's because it's what you know. You don't know.
Initial thought is to like stretch out your calf, right?
Yeah. Like coming from the World Cup, everyone's like,
everyone's like, let me stretch out my keys.
Stretch my leg, man.
Half the time you need to strengthen it. You don't need to stretch it. So like hamstring tears is the number one example we give as PTs. Like the moment you have a hamstring strain, people want to stretch it out, but half the time it's better to do isometrics because it helps kind of regain that neural. So
even my back issues recently, it's like my instincts to like, or even if it's yoga, cat cow, child's pose, it's also adding a level of like inflammation, strain to the area. So I'm like, I keep doing it, and I'm like, this like might not be good.
Yeah.
And my wife tells me to stop, and I'm like, I don't know. I think this is gonna work out, and it doesn't.
Never works out.
No.
Yeah, I do like the knees over toes guy, and I have the apparatus to do the different exercises, like Nordic curls, like different things to stretch your
curls.
Where like you gotta kind of, it's almost like doing a reverse leg curl, but you're doing it with body weight. So you have your leg stuck on the thing, and then you're just like going up
doing
and
like
down.
the Michael Jackson, like
Yeah. I thought it was just
they're tough.
Like
no, they're really hard.
Yeah.
I thought it was just exercising while you eat smoked salmon.
Yeah,
that sounds like a Nordic curl.
Yeah, I don't know why it's called Nordic curl, but it works really well, especially for your tight lower back. How about like, so I got to try this thing out. I bought this, like they have an EMS underwear. So I haven't tried it out because I haven't charged. Yeah. So it's like a tense machine.
Try everything.
I know. I was
shocks your balls while you're asleep, like 3 times an hour.
I was on the website,
just make sure you're
just getting something, a red light thing for my shoulders, and like, and I'm like,
what website are you getting?
This is
on?
very interesting.
Timu.
What was it? No,
Timu.
No, it wasn't Thersage. It was a new one I tried. I forget what it was, but I was like, this is interesting. The CMS boxers. I'm like, how long are you supposed to wear this thing? And it's boxers. Like, how do you wash this thing? It's like, you know, so.
He's willing to try any of that out. Oh, one thing before we run out of time.
I was looking for red light boxers, but.
One thing before we run out of time, I saw you're certified with dry needling.
Yeah.
Where have you seen that most effective or very effective?
I would say as a clinician, it's one of the most, like as a PT, it's one of the most like instantaneous things that can help people. Hamstring, that's the number, like I would say that's one of the ones that feel kind of immediately good after is if we dry needle the hamstring. If you get a hamstring strain right in this symptomatic area, they feel pretty good right after. Get a little bit more extensibility and follow it up with exercise, of course. I did have a patient, stiff ankles, like limited dorsiflexion, right into the dorsal retinaculum. And you stim it. You can e-stim it too. Immediate results. So there's a bunch of different
Yeah.
theories of how it works and why
You
it
get
works.
addicted to it because it's like,
Yes.
Yeah.
it's like this, it's painful, but it's like, it feels so good after it.
Yeah.
It's like
Because I had
microdosing.
his wife do it on
Yeah.
my back. My delts were like just like in knots, and it's like you could almost feel them unravel.
Yeah,
it
upper
was kinda
traps,
crazy.
I would say, is
Yeah.
the
Yeah.
most
Yeah.
common thing that I
She
needle.
did some on my lumbar
Oh, gosh.
area and the iliopsoas with like the long ass. And I was just like, I can't do this.
Yeah.
That's the
I'm
It's
a
like it
bitch.
hurts, and then you're like, oh,
You're like,
that
oh
feels
shoot, but it
good.
feels really
Yeah.
good after, right?
Yeah, it's
Typically.
either
can I do-
after or 24 hours
It's always-
after. Sometimes you
yeah.
have that soreness for like
Uh-huh.
that first day,
Yeah.
but then the next time. But like you're saying, like people get addicted to it. Like
Yeah, I was like,
one-
can I call Sarah next day?
Yeah,
I'm like,
one
like,
I
how
person.
need
can I
it.
find scheduled time for this?
Yeah, one person in Sarah's clinic got like certified
Yeah.
for it a few years ago, and so he's just needling everybody, and every other practitioner in the practice is like 7, 8 like physical therapists.
Mhm.
They were all like, okay, I'm gonna go for that course, and then they were just like, she's like, yeah, I have to stay like 30 minutes late because I'm going to dry needle this person. And they just like all the therapists, like simple like aches and pains that you would like just walk around with. They're like, oh, I'm just going to get dry needled.
Sounds
for
about
that.
right.
Yeah.
How's that different from acupuncture?
Good question. So it stems from acupuncture. It's kind of a common misconception. So acupuncture is the old world technique, like Chinese medicine. That's where it stemmed from. So they took the needles from acupuncture, some researchers, and
They just pushed it deeper.
deeper. Basically, they're like, let's go deeper. Let's go into the actual tissue. Let's go into the muscle. Let's go into the fascia. Let's go into the bone, ligament, tendon, whatever. And they found it can create different responses based on the person, based on the tightness, based on whatever's going on.
Yeah.
And you do it for different reasons. So one of the main points is trigger point dry needling. So a lot of times with upper traps, you look for that top band, you see that nice little twitch whenever you put it in, take it out immediately. And that should help kind of reset neural pathways in your upper traps to help kind of relax the muscle. A common like analogy I give for sometimes when it gets stuck, so a lot of like the collagen fibers, actin-myosin, it all like attaches to the needle, kind of like winding spaghetti on a fork. And so it like gets really, really winded up. When you release the fork, everything kind of releases. So that's the one analogy I give to my patients. That's what's happening at the cellular site when you get dry needled. So it could be pain relief. It could increase flexibility or extensibility of tissue. It could increase muscle activation. So a lot of times after knee surgery, ACL, right in the quads, you stem it. You give a little bit of that jump with the stem. Better quad activation with dry needling. But yeah.
How many areas could you do at once?
As many as you want.
Yeah.
I don't do, but in the course, you get a lot done. They call it needle drunk. So you get a lot done in 2 days. So it's a weekend course. And there's a bunch of different people that do the courses. Weekend course, head to toe, needled, like 250 insertions. By the end of day 2, you literally just feel like a limp noodle. Like we call it needle drunk. And so I went home at 6 p.m., went to bed, like took a shower, went to bed immediately. And you just like feel like everything's loose. And I'm already so hypermobile that it was just like probably not the best thing for me to do, to be honest. But I mean, it's just positioning, like based on positioning. And you don't want to overshock the nervous system.
And anyone do it under ultrasound, or you're just going?
Yes, that's a newer thing. I would say they're doing ultrasound guided dry needling just to help the patient see, but also so you can see how deep you're going. But that's more like emerging tech, I would say, in the PT world.
I don't think it's necessary personally.
I don't think so. Yeah.
Yeah.
It's more of
Because
a
a lot of
feeling.
times, like even like we'll dry needle each other, and with plastic surgery, I kind of know anatomy and like where she'll be afraid to go like a little deeper. I'm like, yeah, it's
fine.
like okay, you could cause a pneumothorax if you go too deep, like next to the lung. I'm like, I'm pretty sure I'll be able to tell before I go that deep, and then just gauging how, because they have different length needles. Like she's used some needles that are about like I'd say like 3-4 inches.
Like your psoas one
long.
is probably 4 or 5. Yeah.
Yeah. And then there's some that are really short.
Those are.
But that's still a lot longer than your acupuncture needles, which are pretty much like skin and subcutaneous tissue for most of acupuncture.
Yeah, and it's subcutaneous tissue, right? So you always want to err on the side of caution with PT. So I'd be the exact same way with the neothorax thing being anywhere close to pecs. If you go through like the first dry needling courses, the intro courses, you don't even touch anywhere besides pecs and lats, but that's the lift technique. So you pull away, then you stop it. But as you get more certifications,
You just get more comfortable with
comfy. Yeah, it's more more on comfort based, but I kind of stray away from anything that's close. Like I would never needle in the rib cage, even if someone asked me to.
Yeah, I saw papers about it, like causing a pneumothorax, but like even when Sarah's like sticking me with the needles, she's like, "Oh, I'm kind of scared." I'm like, that needle's so tiny.
Exactly.
Like if you even puncture the lung with that size needle, the chances you get a pneumothorax is extremely low. Like just go ahead, go deep.
It's big with our breast cancer patients too.
Yeah.
I wish like we could get more of them into like dry needling, especially when they get radiation and stuff. It's
with radiation especially.
because
Definitely.
everyone's like caught and they can't move their arms above 90, like especially after radiation.
Oh my gosh, yeah,
I
that
think
would
it
help
would
so
definitely
much.
help. Yeah.
I think it helps a lot with like superficial restriction.
Yeah.
Just from surgery, not moving around, that superficial fascia, I think like if you're just like your muscles, if you don't stretch them out, it doesn't mobilize as much. So it even with mobilization techniques like that keeps that fluidity and I don't know, the stretch in that layer, which helps because it's like another area of restriction on top of like your muscles, like just getting used to not moving around as much.
Yeah, absolutely. I mean, there's tons of PTs too that are certified in breast health. So I think that's a super important point to bring up and think about the dry needling part. So yeah, that would work.
Yeah.
Sure.
And one thing with the
cupping and
breast
dry
health
needle,
and
yeah.
stuff, cording, axillary cording, we see a ton of.
Okay.
A lot of people like say, "Oh, I just had the breast surgery, so I can't move my arm past this," but they're like maybe like 80-90% like range, but they tell me like when I go past this point, I feel this, but there's a lot of people don't address that cording in the armpit or axilla, where physical therapy with that specific area is so like within like 2 visits, like it just completely releases that. And people don't realize like how, okay, you might have to cut out an hour of your day, 2 days this week, but like the benefit you'll get, like you can't quantify it, but like you'll be so much more comfortable.
Yeah. It's just like showing up is the hardest part. I feel like, especially they've gone through so much already that it's like one more appointment they have to deal with.
Yeah. There's a lot of doctor's visits.
Yeah.
So your plastic surgeon, your breast surgeon, your
Oncologist,
radiologist,
oncologist,
medical oncologist, on top of your regular doctor's visits. So,
but it has made such difference in the patients I've seen that have had breast cancer before. Like, yeah. And seeing a breast health specialist in general too. They're far and few between, but yeah, I think it's awesome.
Yeah, that's why we send pretty much everybody to physical therapy, even if they don't have like real complaints.
Yeah. Love that.
As long as again, I'm biased. My wife's a physical therapist.
Yeah, which is great.
So it's like, okay, I know how much it's done for me when I've thought I had no problems. But yeah.
So rapid fire questions. We do like questions before we end.
Us off.
Yeah.
Oh yeah.
Yeah. So 8 questions.
Okay.
So Pilates or weightlifting, pick one for the rest of your life.
Weightlifting.
I would say Pilates.
Really? Yeah.
Not on
longevity,
anything.
but
I'd say Pilates. Yeah.
it's a tough call.
Nuanced, but
Yeah.
Best after workout snack.
Best after workout snack.
Pork rinds.
Shake, like a good protein shake. I love mangoes, pineapples, anything with that.
One stretch or mobility drill everyone should do daily.
I love a good quadruped, thread the needle. It's one of my favorites.
All right. Dry
What's
needling.
the quadruped? Hold on.
Like all fours. And then you go thread the needle.
Oh,
Open
okay.
and close.
Yeah,
One of my favorites.
Dry needling, yes or no for yourself?
Yes.
One exercise you'd ban for if you could.
One exercise I'd ban if I could.
Bench press.
500-pound clean and jerks.
Down, clean and jerks. I hate Zercher squats. I hate them.
Do you?
Yeah.
I've changed. Well, with the resistance bands, I've switched from doing the front loaded squats because the band's shorter, and I actually like the Zercher squats.
I like banded
The what
front
squats?
squats,
What?
like
Zercher.
Zercher squats.
Zercher squats, you hold it on your
I just have weak forearms, so like,
Okay.
yeah.
Foam roller or massage gun.
Foam roller.
Foam roller.
Weirdest place you've ever done Pilates session?
Weirdest
Ollie.
place I've ever done a Pilates
Yeah.
session?
Some random dude's like truck container.
In my
Like
backyard.
my balcony? I don't know.
One body part most people neglect.
Core.
Yeah. All right. Thank you.
That's it.
Thank you.